Hello and welcome to Onboarding Training with me, Michael Frost, for the class SPCE 638, Section 803. This training will be on the process of onboarding new clients and the different information you will need, going through that and where you can put this information. So we'll start with an overview. The onboarding process is meant to keep information used when onboarding new clients organized and easily accessible. It gives places for assessments and their results and the important information relevant to the new client. This is also where the frequency of services can be found, as well as any other services provided, such as speech therapy or occupational therapy. We have this document here because it allows insurance and intake specialists to easily access the information needed when beginning a new client in services. All right. So the purpose of this training is to teach you how to use these different tables and forms. It'll teach you the relevant information you need when forming a VIP, the relevant information you need when gather when bringing in a new client, and it will enable you to determine the services needed as well as the provider that can best provide those services. So we will start with the first section, which is client information. This is a short table that details the client's basic information. You will find their name, the guardian's names, their contact information, and their date of birth here. You will also find the important information such as their allergies, medications they take, and previous treatment history. This will also be where you find the family background. If the client was administered any assessments, they will be stated here along with the dates that they were administered. And here is a look at the table. As you can see, we have a section for the client's name, the date of birth, the address. We have medical history, any medications prescribed and allergies, service history, any previous clinics and BCBA evaluations, school enrollment history, psychiatric evaluations, diagnosis, current family living arrangements. In this next section, we have the primary guardian, the primary pediatrician, and emergency contact, as well as the address and the clinic contact of the clinic. In this last section, we have the assessments. We have this example of AFLS and PEAK, but we also have places for the Vineland results. These are just some of the assessments that could be given. You also have an area where the justification for the assessment is placed. That way, the reasoning behind the assessment, be it age group or functioning level, can be within clear view. So our next section is diagnostic criteria. This section looks at the diagnosis, the physician who made the diagnosis, and the severity. Here we have a small table, and in this table you have the diagnosis, the severity level, the date of diagnosis, and the name and credential of the diagnostician. So when you see this fully filled out, there will be a code and a severity level, which could be level 1, level 2, level 3, and then the date that the diagnosis was carried out, along with the name and credentials of the physician who made the initial diagnosis. Alright, next we have the behaviors section. This section is also a table, and it displays the behaviors that we're going to be targeting for reduction. They can be added as the need arises. In this section, you will also include the theorized function of the behavior and the operational definition. So we have a table with 3 different rows and columns. What you would do is you would pick the behavior, and then you would have the operational definition and the behavioral function. So say we decided to target the behavior of elopement, and we would put that at the very top section up here. The operational definition, it could be any instance in which the client moves more than 3 feet away from staff or parents without asking, and then does not return within a specified amount of time, say 2 or 3 seconds. And the behavior function, it could be any of the theorized functions. Maybe it's for escape from demands. We'll just go with that. All right, so the next section you will be looking at is skills goals. This section focuses on the goals set for the client. We can base these on concerns of the guardians or the results of the assessments. When the target related to these goals are put into baseline, data from these baseline trials can also be placed here. We will also need to put a justification for the goals that will be added into the same section. So why they're important and why they are going to be worked on. This is something important for insurance purposes. So we have a section for target with mastery criteria, justification for the goal, baseline data and date. So say the target was, we'll use one from a later slide, identifying community helpers. It would say client will be able to independently identify, say, 10 community helpers with 80% accuracy across 3 sessions. The justification would be to be able to identify a community helper they need when they need help. They need to be able to identify the police or a doctor or a dentist. That way they know who it is, and these people that may be scary to them or may be able to help them are easily identifiable for them. And then baseline data and date, that would just be the baseline data, how many they got wrong, how many they got right, and then the date that this baseline data was taken. The next section is the referral. This will be where, if there is further need for services, referrals will be done here. This is where the frequency and intensity of data will be considered, therapy will be considered, and the reasoning behind the referral will be added here as well. So our next slide has the referral sheet. You have your referral type. You have your services needed, ABA therapy, speech therapy, occupational therapy, physical or feeding therapy. And in the form of this therapy, is it one-to-one? Is it group, social group, academic group, and the intensity of the services? Daily, bi-weekly, or weekly. It just depends on the client and the assessment of their initial time with whoever's assessing them. This next section is the recommended BCBA. So all clients have different needs and different behaviors that are specialized in by different BCBAs. So this will be where the BCBA that best fits this client is placed. Their relevant experience is also highlighted here. So you will take the BCBA that you are recommending. You will give their area of expertise. So if they are experts at dealing with elopement behaviors or aggressive behaviors, if they specialize in behavior reduction, if they specialize in skills acquisition, you would kind of put that there. That way you kind of have an idea of who should be consulting on this case. And then you'll put their experience in years. You don't really want to put a new BCBA with a client that has a really intense level of, say, SIB or aggression. You'd probably want someone a little more experienced in that field to be on that case. So now we have the service schedule. This next session discusses the proposed schedule. This will include the hours of direct therapy, the days of the week, and the services provided, as well as the location. And here we have an example schedule. As you can see, they will be at therapy all 5 days of the week. Saturday and Sunday are added purely as a makeup session, just in case. You have the services that will be provided: ABA and SLP on Monday, ABA and SLP on Wednesday, just ABA on Tuesday and Thursday and Friday, and then you have the time that this therapy will be taking place. So it seems to be every day. It is either 8 to 5 or 8 to 4, with an extra hour added on those days where they'll have SLP to make up for the hour of therapy they won't have. And then it has the location. This is going to take place in the clinic, home, or other. So other could be at school. Are they going to receive their services at school, or are they going to receive their services in the community? It just depends on the initial assessment of this client. The next section is the progress section. This section will track the progress of the client. This will include some of the new programs listing the current goals and the date of mastery, as well as the new goal. So earlier we talked about, all right, it took me to the wrong slide. Earlier we talked about how they had community helpers as an initial goal. So say they mastered that goal and then we wanted to move on to a new goal, we would move on to listing the community helper's job. So instead of just saying that's a fireman, we would say, who is this and what do they do? And it would be, it's a fireman, he puts out fires. Or a dentist, he's a dentist, he fixes teeth. So this next section is the challenges of using this material. The amount of information is a common challenge, as well as needing this information to come from different sources. This also requires that you prepare several parts of the BIP and programming, causing time constraints. You're going to want to take your time and come up with a good amount of goals and a good justification for these goals. It's not something you could just do in one sitting. It would be best to begin ahead of time with gathering information and to begin forming programming based on parental need and then adding the goals over time based on assessments. You want to start broad and then narrow what you need. So you won't just go straight into community helpers. Maybe you'll start more broad with receptive ID of, people based on their pronouns, something like that, and then narrow it so that they're able to easily identify differences of people. Best practices. Save copies of all the tables in the blank materials. This way you can easily fill them in when you have a new client onboarding. You want to ensure that all providers have access to this document in order to ensure that they are aware of the schedule and needs of the clients. Take the most pertinent information, such as allergies and medications, and make it easily available to staff working directly with the client for their safety. So if you have a client that has an allergy to peanuts or to dairy, you want to make sure that the people who are working with or around that client know this. That way they can keep that client safe and he won't be exposed to these allergens. All right, here is a quiz. Which section would you look in to find the days the client will be in clinic? Is it A, the schedule, B, the diagnosis, or C, progress? The correct answer is A. The next question is, what are two methods that can be used to determine programming? The answer to this would be you can use parental or guardian determined goals, and you can use assessments based on assessments. What skills do they lack and do they need to work on? The next question is, what are two assessments that may be a part of onboarding process? This can be the Vineland, this can be the BB map, this can be the ABLES assessment. Those are some examples of different assessments. And what is one important information needed for intake? The important information would be absolutely medical history. That will be very important for us to know. Conclusion. The most important parts of this training are to gather relevant information, organize the information, and to update this information as it changes. The information gathered here should be kept private, though some can be shared with the individuals working directly to ensure client safety or with other providers to ensure that they provide the best services and are well equipped to take on this client. Care should be taken to ensure you have the information organized and up to date. You should ensure that you focus on these sections one at a time if possible and ensure that any information you put in there is relevant and necessary, not to leave anything out. And lastly, we have a little visual for the important information you need. Also included with this will be the copies of the blank tables for you to fill out just in case you want to practice it or for when you have a real client starting and you can easily pull that up and just lug the information in. So the most important information to remember is their personal information, their behaviors, their goals, referrals, skills, schedule, the BCBA that is being recommended for them to work with, and then progress. Thank you.